Welcome to Holistic Hub with Dr. Shreyas, where we explore the forefront of holistic health and integrative medicine. Today, we have a very special guest, Dr. Nagarathna ma'am. Namaste, ma'am. So, Nagarathna ma'am is the pioneer in the fields of yoga therapy and integrative medicine. Ma'am has treated more than 5 lakh patients through integrative treatment, developed disease-specific yoga modules, and led groundbreaking research in areas such as asthma, cancer, diabetes, and psycho-neuro-immunology with more than 450 research publications. As a medical director of Arogyadhama Holistic Health Center and a key figure at S-VYASA University, she continues to innovate, combining modern medical science with ancient wisdom of yoga. Ma'am has completed M.B.B.S from Bangalore Medical College and M.D. in Internal Medicine from Mysore Medical College. She holds M.R.C.P and F.R.C.P in Internal Medicine from Royal College of Physicians, Edinburgh, UK. She has held the position of Registrar in the Department of Rheumatology in West Lane Hospital, Middlesborough, Cleveland, UK. She has been awarded DSc by Kuvempu University and S-VYASA University. She was awarded the Best Abstract Award for Diabetes Prevention through Yoga-Based Lifestyle, a pan-India randomized controlled trial by American Diabetes Association 79th Scientific Session in San Francisco in 2019. She was awarded Kannada Rajyotsava Award from Govt of Karnataka, Patanjali Award in 2000 for contributions in the field of yoga by Indian System of Medicine and Homoeopathy, Ministry of Health and Family Welfare, Government of India. She has produced a TV serial in Chandana TV about yoga for various diseases, having aired more than 50 episodes. Get ready for an insightful conversation as we dive into her journey, her research, and the transformative power of yoga in healing. Welcome, ma'am. We are thrilled to have you here.
Namaste.
Namaste, ma'am. So, when and how you were introduced to the Indian systems of medicine and knowledge?
It is interesting that as a medical college student and even before that, we were exposed to yoga, Vedanta in particular, where we used to have regular weekly satsangs. And we had a very interesting yoga teacher who would make us bend our body to the core. He was a tough master. So this used to happen week after week or for several years. And Vedanta became a very interesting topic because for the intellectual you can go on challenging questions after questions, questions after questions. And so that way we were exposed to in-depth understanding of the Indian philosophy of yoga in general and mind management through yoga. When I started becoming a professional, the most touching part was, I think, 74, 75. I was working as a rheumatologist in the rheumatology unit, and we used to see lines of people lying with 10 joints replaced, 5 joints replaced. And because my hands are small, I was trained to give small injections into minute joints also. But even as early as 1960s, medical science had understood that the root cause of rheumatoid arthritis was related to psychosomatic factors. We used to call it as psychosomatic those days. Later it became termed as mind-body disease and now lifestyle disease. Only name has changed. But today we know very clearly the entire pathway of how mind causes these inflammatory problems affecting the joints. So thought started coming, why not give them some mind management techniques through simple body movements, breathing exercises, and I became very popular to put them to sleep after everybody has retired. When it is sleeping time, I would go to the ward. There will be 20 people lying there. I would give Shavasana instructions that they started feeling better. This was the only amount of application in therapeutic area I had observed. But when I came back, Guruji, our Dr. Nagendra, who had already returned from NASA, was working in Kanyakumari as a yoga director. So I said, why don't you come over? Let us see what we can do. So we started understanding deeper aspects. Even then, although we knew yoga is useful for mind management, yoga is useful for correcting some imbalances at the mind level, we really did not know how to apply it in therapy, how to apply in sick people. So we decided that I'll go around the entire country, attend, observe what yoga is being practiced for therapeutic purposes. So I started on the east. Hyderabad, there was a Swamiji who used to treat. Then went to Kolkata, Arunachal Pradesh, Assam. So around the country we spent almost 3 to 4 months. I had a very good therapist with me. He knew all the practices, including Kechari Mutra and all he used to do. So here is a yoga professional who knows all the practices. Here are Swamis who are treating patients. So I used to interview the patients, talk to the teacher, talk to the Swami there, why and how they are teaching, and started documenting. When I came back to Kanyakumari after 3 months, we started deciphering the techniques. So what should I teach? Although I know the asana, although I know the pranayama, although we know the practices, what to apply for which disease, why, how it works, all these we had to start thinking. When we went through the whole document that I had written down, it was total chaos. There was no uniformity. One Swami says you should never do this asana. Another Swami says you should do this asana. One Swami says you should do only pranayama. Total chaos. Then we could have easily discarded those data. But I have seen the patient. In fact, I remember the first case that impressed me was in Assam. One lady had perimenopausal menorrhagia, and she was very anemic because of menorrhagia. It had come down to 5 grams. So the surgeon had told, we'll have to wait for 1 year, at least 1 month, for your hemoglobin to come up before I do surgical hysterectomy. That 1 month period, that lady was taken to an ashram, and Swamiji taught her some techniques. And very next cycle was normal. So she continued. She never had to have hysterectomy. This was a very touching experience for me for the first time. So I documented. So finally, I have seen the patient myself. They have improved. This Swami says this, another Swami says another thing. What could be the reason? After 3-4 days of intensive thinking, Guruji in his meditation came out with answer. Oh, now it is all understood. They are all doing yoga. Maybe through this asana, or through that asana, or through this pranayama, that type of pranayama. All the Swamis are teaching them yoga. So what is yoga? Mind management, mastery over the modifications of the mind. So mind management, you could use any technique, but help the person to go into their mental calmness. That is the healer. So this helped us to start going into scriptures. And Yoga Vasishta was a very important text in which there are about 12 to 15 shlokas where Rama asked his Guru Vasishta, please tell me how the diseases appear and how mind management can help. So that formed our basis to start developing our protocols. And things went on and on and on, and we went on improvising.
That's really interesting. Just to summarize whatever you have shared, so when you were practicing in rheumatology department in UK, you were giving some shavasana or relaxation practices to the patients, and you found some benefits that they were getting.
They were sleeping better.
They were sleeping better.
That
Exactly.
was the only thing we had observed.
Right. Right. And you had also read in the research papers that there is a huge psychological component involved in the rheumatic.
Positive factor.
It is one of the major.
RA autoimmunity, we know very clearly as medical professionals,
Right.
it is a mind-body disease, stress-borne disease. Today we call it as lifestyle disease.
Right. And so, in order to learn more about this, you came back to India with Guruji, and you went around to various ashramas and gurus to look for uh,
First hand
experience,
experience and validation.
validation. And you realized that everybody had different practices and everybody was claiming different benefits. So you still recorded whatever data you got, and at the same time you observed which practices were helping. Like for example, in the
No, we couldn't do that. Which
Right.
practice would help was
Right.
not my question.
Right.
Still even before we started,
Right.
go
Right.
back
Right.
to 1970s.
Right.
Then we did not know which practice for which disease. Several yoga, we include physical yoga, breathing yoga, meditative yoga, intellectual yoga, devotional yoga. So
Right.
different people were using different techniques.
Right.
So at that stage, we had not even asked a question as to about special techniques that we call today.
Right. So you went into our scriptures and you were trying to find correlations and answers, especially in Yoga Vasishta, as you mentioned. Bhagavad Gita.
Yoga Vasishta, and Patanjali Yoga Sutras.
Right.
All the yoga related scriptures.
Right. So, how did you actually begin the practice of integration in your practice?
Integration, as you have rightly said, Satish, is add-on.
Right.
They would come to us with large number of long list of allopathic medications. Some of them also added on Ayurveda, some of them doing their own meditative techniques or something. So integration was to select the safe practices. Generally, yoga means physical postures. People would only say, oh, I got so much problem, so much pain, how can I do yoga? But from the scriptures, we are very, very clear that yoga is not just physical movements. Physical movement is one of the ways to get mind management. Mind management, I mean, is how to calm down the nervous system, how to calm down our mind. So we started calling this as integrated approach of yoga therapy, where we integrate physical yoga, breathing yoga, meditative yoga to effect using all possible hundreds of techniques developed by sages and started experimenting.
So, how did you decide which practice could be helpful for certain diseases?
As I said, the whole thing is to somehow push our participant to change their lifestyle. What are the lifestyle factors? There are four major factors in lifestyle. One is the diet, number two, physical activity, lack of physical activity, and habits, wrong sleeping habits, wrong eating timings, wrong type of food, and maybe addictions. Addiction today we see screen addiction has become one of the major problem, and overwork on the brain, that is stress. So we had to design modules to change their lifestyle. This is what medical science has proven. And sages said about this years back, hundreds of years back, or even 1,000 years back. So we had to cull out a set of practice which includes all these aspects. So if somebody does 1 hour schedule, it should be 20-25 minutes of physical yoga, then 10-15 minutes of breathing yoga, then 10 minutes of meditative yoga. And the major question was that none of these practices should be negatively affecting the situation. If somebody has got a bad back pain, I should be able to select those practices which will not aggravate the back pain. So we prepared what we call as basic set of integrative yoga module, in which we were planning to give them some preparatory movements, Surya Namaskara, then standing postures, sitting postures, prone postures, supine postures, with lot of relaxation, and pranayama, meditation, and majorly the understanding of why I am doing this, how it is going to help me to calm down my mind. So this way we were careful initially to see that with our knowledge of the pathology and the physiological changes, we should not give them which would harm them. That was the first question. Because there are 100 techniques. If I don't do one of them, it doesn't matter. So we had to prepare the safe practices, and that is how we went on evolving.
So the most important thing was ahimsa, doing no harm, was the center of this. And then along with this, as you mentioned, that there were some postures, some breathing practices, and some meditative practices in that 1 hour yoga modules that you started creating for different diseases.
And started documenting.
So, ma'am, can you tell us more about the conceptual basis of integrated approach of yoga therapy?
This is the basic core knowledge that the scriptures give us. We understand what we call as Panchakosha Viveka, 5 aspects of our personality. What does present day medical science understand? We understand everything about the structure of any organ, the chemistry that is there in great detail. We also know that the entire functioning of the body is all controlled by the mind, which uses brain as its vehicle to control through nervous system, endocrine system, and immune system, which goes on becoming very vigilant to help the body to do its function. So this much medical science has elaborately understood. The chemistry part, the physiological changes part that happens, all this is very well understood. But what did the sages tell us? The sages told us that there are 5 aspects of our personality as a human being. The 5 aspects, they call it as Panchakosha. The physical body or the Annamaya Kosha, which is the solid matter, which is made of electrons, protons, neutrons, atoms, which became RNA, DNA, cells together became tissues put together organs becoming systems. So cardiovascular system, structure we have understood. What makes this structure do its intense activity, we still do not know. But we know anatomy, we know how the system works, what controls, how it controls. That physiology, anatomy, physiology, we know. So what makes this physiology happen? Now what is the difference between a dead body, which has got all the cells, and a living body which is dynamic with lot of chaitanya, which is helping the functions to go on at a very cellular level. That aspect of the physiological functioning capacity where the system is continuously programmed to work in a particular pattern, we call it as life energy or pranamaya kosha. Okay, body is healthy, body is working, physiology is going on. Can we modulate this? Can you change this? We always decide with our mind. For example, if I have to move my hand, I decide by my mind to send the energy to the structure, the Annamaya Kosha, through prana. So who is that? That is our mind. Mind is the thinking apparatus. There are two components in our thinking apparatus. The lower mind, which perceives response. Subtler than that is this lower mind or involuntary mind, which is a programmed mind, is called Manomaya Kosha. Subtler than this is also our thinking apparatus, which is guiding, guarding, advising the mind which is reacting. For example, if somebody hurts me by giving wrong insults, what did I do? I perceived who is insulting me. That is also happening involuntarily. And immediate response will be, I get angry, I may shout at him, throw him out, or run away from the situation. Situation, response, all programmed. But I may even shout at the person, how can you call me by these names, insulting words? So receiving, responding involuntarily. Behind that is our voluntary Vijnanamaya Kosha, discriminating capacity, which will stop this response or encourage this response. So controller of the lower mind, the Manomaya Kosha, is the Vijnanamaya Kosha. So these are the 5 aspects of our personality, behind which is our deeply rested mind in our deep sleep. We all want sleep. If we go on working with our body, mind, breathing, etc., we will get exhausted. So we always have to have a good sleep to rest the brain activity. And what are we in our deep sleep, which we call as slow wave sleep? I am rested, but I am living. Basic body functions are going on, but brain is not active. This state of zero thought state, where system rejuvenates, repairs, restores the normalcy, is the Anandamaya Kosha. So what the sages told us was, in all these psychosomatic diseases or lifestyle diseases, what decides? We said diet, lack of physical activity, wrong habits, and overwork on the brain. All these functions, although they are 4 different, all these are controlled by our mind. So it is my mind which pushes me into junk food. Everybody knows what is junk food. In fact, we used to run a personality development camp for children. Once I was supposed to take a class on diet for these young children, and I asked them, these are called junk food because they are very tasty, they are very colorful, and very nice to look at, and very tasty to the tongue, and very clean also. But once it goes into the stomach, it is very dangerous. Can you tell me some names of junk foods? The boys, the young boys, 10-year-old boys and girls, they knew longer list of junk food names than what I could know. So we all know what is junk food. Why do we call it junk food? Because it is dangerous for our system. But why do we still get attracted to junk food? Mind. We know physical activity is important. Obesity is the root cause for many problems. But why we don't do? Because of the mind. Wrong habits, mind. Overwork on the brain, mind. So that is why medical science itself call it as mind-body disease. But what is it that I am doing with the mind? What is it that is happening in the mind? How to handle this mind is the big question that has not yet been answered in medical science. And here is a 5,000-year-old science which worked only on mind. Their starting point was the mind. When the intellectual questioning mind asked what is the way we should understand the fundamental principle of this body or the universe, they wanted to investigate and find out what working on understanding intellectually the most highly evolved aspect of our human system. Compared to plants or animals, human system is supposed to be more evolved. So in our system, which is the most highly evolved, mind. So the entire research, entire concept, entire basis of understanding the basic unit of this universe was through mind research. Whereas in modern science, we start with the physical world, which is easy to tackle. But they said, leave the physical alone, we let us understand the mind. So 5,000 years of research have given us the understanding of mind, what happens in the mind when you are happy, what happens in the mind when you are distressed, and how it controls the manomaya kosha or the pranamaya kosha or the physical body. And this gave us the whole conceptual basis. And another very, very interesting concept in our yogic science is talking about diseases as professionals, medical professionals, we should understand this very clearly. We now know that all are psychosomatic, mind, body. What is happening in the mind which is creating all these problems? We say, okay, persistent negative emotions, anxiety, fear, depression, frustrations, which disturb sleep is the root cause. This much we know. But what exactly is the phenomenon that is creating this problem? We have to listen to our great masters. Sage Vasishtha gives a very, very simple, ask you a very simple question. My dear child, tell me your experience by looking inside. What exactly are you doing in your mind when you say you are very anxious? Example, we are talking like this, suddenly there will be a fire alarm. I become very anxious. Take that now, imagine, and tell me what exactly is happening in your mind when you said you became anxious. Even before you ran out of this place to fight the fire or fly away from the fire, it was the anxiety. My God, there is danger. It happens so fast that we cannot decipher it. But as a intellectual, if you try to understand now, what were the rate of thoughts in my mind? My God, there is danger, let me run. There is danger, run, 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 danger, run, run, run. Or persistent anxiety also. What will happen? Yesterday I met one participant who said, when I has to go and give a presentation on a PPT, I become so anxious that I become blank. So those moments of anxiety, what is happening in your mind, you have to observe and report. What happened? I have to go and give a presentation. Will I do very well or not? Will I be impressive? Will the audience receive it in the right spirit or not? 3-4 sentences. I won't be worrying about my family or any other thing. Only 3-4 sentences. But it has become an anxiety. Why? What is the process? In these 4 sentences, it has picked up enormous speed, and that speed is necessary for a good performance. If I am alert and active and very quick in my understanding, it is very helpful. But what is the difference between helpful speed and anxiety speed? That is one word they introduced. Uncontrolled spinning speed of thoughts. Whereas when I am for example, now we see lot of programs on the TV where young boys are given a question and they have to press the button and give the answer. So speed training is happening, which is useful, very fast responses. But if it becomes anxiety, the child cannot perform. What is the difference? This is controlled speed, that is uncontrolled speed. So this is the root cause of all psychosomatic problems, root cause of all our so-called lifestyle diseases. So uncontrolled spinning speed of thoughts in the mind, if persists, short term it is useful. Fire alarm example, it had to pick up speed, we had to run, it helped me by the mind controlling the prana. Prana pushed to the limbs, we increased the activity, pranic activity in the limbs, and we ran. This is short term control speed is helpful, but long term persistent psycho-emotional situation, all human beings go through one or the other difficult situations in life. When the challenging situations come, we get stuck in our responses. So this is the greatest contribution of Yoga Vasishta, which is the definition of stress. Stress, we are experts today. We talk about stress-related diseases. So what is the definition of stress according to modern science? Response of the mind-body complex to challenging situations. What is the pattern of this response? We need to listen to our yoga masters. This response is USST, uncontrolled spinning speed of thoughts. That percolates into the prana, that percolates into the body, stimulates our activity, increases the activity level, and that makes me run or collapse also. So the whole of the problem, whether it is rheumatoid arthritis or autoimmune disease or neck pain, back pain, acidity, asthma, hypertension, in all NCDs, the root is the mind, and in the mind, persistent, long-term, suppressed negative emotions which has become habituated, USST or uncontrolled spinning speed of thoughts, on which we have no control. It has become habit, and that is the cause for this. So the entire management should be to slow down and switch off these responses, isn't it? It is like removing the root cause of the problem. If somebody comes to you with hypertension, you need to decrease their blood pressure by giving beta blockers or calcium channel blockers, whatever, so that the system doesn't get into terrible damage. That is only at the periphery. And same medical science is telling me that the root cause is in the mind, which went through 3 or 4 stages. First stage, your BP never was high, but person was working, uncontrolled speed, emotions got added up, and he starts losing sleep. This is stage 1 of the stress management. If you go to Google and look for how do we recognize stress, it clearly says that it is making you more irritable. A calm person becomes irritable. Decision making becomes difficult. Long list of indicators of stress. I read one very interesting definition of how to recognize our own stress. One, it was a small clipping in the social media. Very interesting. They said, how do you know whether your mind is stressed or not? they said, okay, you're busy with your job, you're doing your work, and work is just over, you have a short gap. Then mind suddenly goes back to that challenging thought. Again your work, gap ho gaya, gap came in my committed intellectual work, mind goes back and back and back to that demanding situation which is unresolved. And there it is, uncontrolled speed. So sleeplessness is the first level of stage 1 stress-related health issue in chronic stresses. Then it starts showing up at the body level where prana activity has become heightened. Prana has become more active. What is prana? Prana is that life energy which increases if required by itself. It's all programmed like a chip at the bottom of the spine, which is there in the cloud, and it can increase by itself, decrease by itself. And I have to do too much brain work, I push more prana there. If I have to do more limb work, I send more prana there. Once the work is over, prana reduces. Then prana is that can increase by itself. Swayameva tanavam yati, swayameva kshenatam yati. It can increase by itself or decrease by itself. So this software program like phenomenon, we do so much prana because I am doing too much work there. And over a time, it becomes so heavy that I started losing sleep. Then we learned to push that prana down to lower parts of the body, and I start manifesting with neck pain. Software engineers, what are they doing today? They are working 14 hours a day, and they start getting shoulder pain, neck pain. Then at that stage I go to the doctor. Nothing is abnormal. MRI is normal, X-ray is normal, all your blood parameters are okay. So it must be a muscle spasm, they say. This is the stage 2 problem of psychosomatic. Stage 1 was where it only disturbed the
Sleep.
mind, then it disturbed the prana.
Right.
So too much of activity manifesting at the physical level. Then after another year or so, pain was continuing up and down, took some physiotherapy, manageable, chalta hai. Then the pain became suddenly very bad, went and did an MRI. It started showing some abnormality. That is when it has percolated as stage 3 disease, where it shows up as damage, structural visible damage to the tissues. And if left alone, it can cause a lot of nerve compression or paralysis, which is the stage 4, which we call as complication. Apply this concept to any disease, be it diabetes, hypertension, which goes on to kidney failure, or hypertension that goes on to a stroke, or cardiovascular disease, which goes on to a MI. All these are the manifestations which started at the root as uncontrolled spinning speed. And how beautifully sages recognize this. But now, what do I do? How do we handle this? What yoga can offer to correct this root cause, mind management? Again, they simplified to this extent that it becomes so difficult to even accept. Everything is speed there, uncontrolled speed. Reduce the speed there. Reduce the speed of thinking, speed of your violent emotions. So mind slowing down trick is the process, which is called as manaha prashamana upayaha. So this is what we need to do. So as a medical professional, what we should help them, we should reduce the speed of the mind. Yes, that's what we do with Alprax or Alprazolam or clonazepam if somebody comes to you with a lot of insomnia. But that cannot be the final answer. Yoga is all about self-correction, self-improvement.
So you are saying is if we look at any disease and we apply the Panchakosha model, we can see that uncontrolled spinning of mind, if it persists for a longer time and if it is uncontrolled, it will first manifest in just insomnia, like it might change from condition to condition, but eventually that will percolate into other koshas, and slowly we will start seeing actual damage that can be evaluated physically. But the damage, when we start seeing those symptoms physically, it is sometimes already too late,
Yeah,
because we have already missed the subtle signs that something is wrong with our body.
exactly.
Right.
So, based on this concept, you asked me the question, how did you develop these protocols? So, we have to tackle at the physical level also, breathing level also, prana level also, mind level also, and because of the long standing persistent stresses, they would have accumulated a lot of stress toxins in the body. So, we have to detoxify also. So, we have to include practices at the physical level. First, change their diet to simple, wholesome, vegetarian, freshly cooked, regular, timely meal with enough nutritive content. Medical science has given us very good concept about what is a nutritious food and what percentage should be carbohydrates, proteins or fats with lot of micronutrients. All this knowledge we shall keep it, but make it a sattvic diet where, again I repeat, regular, timely, homemade, freshly cooked vegetarian food, which is lot of fiber, cooked vegetables, sometimes raw vegetables and fruits to be increased. To do this, we need to give them more understanding as to how food is influencing our gut and gut is influencing our mind. This knowledge also we have now understood. Again, sages said, first treat the constipation. But in medical science, we never knew what is the big thing about clearing constipation. When I used to work in UK, my surgical friends would tell us, my God, Amma, I opened their abdomen and the entire colon was loaded with feces. Because medical science never looked at the constipation component, which we are understanding in the last decade, how important gut clearing the bowel, toxins, etc. is important. That is why sages told us, give enough fluids and fiber in sattvic style so that they can have a cleansing. That we have to change. So we incorporated that. Again, if it is a kidney disease, we take the concept from medical science and make it a sattvic diet which holds on to this knowledge. Then we have to do physical activity. If they are underweight, different type of physical activity. If they are overweight, different type of physical activity. Physical yoga is also very important, because at the stage I am seeing the participant, it is mind which is uncontrolled, but in the joint it has already settled down as an inflammation. I remember one participant, he was a very sincere sadhaka, a sadhu who came here. He had diabetes, obesity and knee pain, hypertension. He is a very sincere sadhaka. He does mind management very well. And they used, in their system, they have to sit for meditation from 3 a.m. to 6 a.m. and then start working for their seva. So every day 3 hours meditation he is doing. Meditation is slowing down of the mind. Meditation is switching off the mind. Then what am I going to add to him? What is our understanding? This Swamiji understood this concept. Because of my lifestyle, because of my very active, useful overwork on the brain in my seva activity. He was a administrator, performer, taking care of the whole ashram duties. So because of this even useful overwork and reduced sleep, I have created some imbalances at the prana level and the annamaya kosha level, which I know how to detach from, get off into in my meditative state. That is what created my obesity, my diabetes, and knee pain. So he understood this concept so well that, to put it in simple terms, what he had to do was do a few physical movements in the form of asanas to enter into the sick part of the body. So because he had knee pain, we were asking him to concentrate on the knee. That's what Patanjali says, Sthira Sukham Asanam. When you maintain in a particular posture, you relax that part. Or in other words, meditate from your knee. Instead of meditate forgetting the body, meditate from the sick part. And he was telling me that, yeah, now I have understood. My meditation also has improved. My body pain also increased. Body pain also reduced. So, in fact, within about 3 to 4 weeks he stayed. He reduced 20 kilos weight, his diabetes, no medication, and he was running like anything. I visited his ashram 1 year later. He was taking me across a river bed and he was walking faster than me. No knee pain, no diabetic, under medication, and he was very, very happy. So this understanding that I should also incorporate physical postures at the Annamaya Kosha in therapeutic situation. What is the principle? Deep rest to the sick organ with awareness using a movement. This is the understanding of using asanas for specific diseases. Then we incorporated pranayama, which is very, very important, that connects the mind to the body. Pranayama very clearly Patanjali says, Shvasa prashvasayoho gatir vichedaha pranayamaha. What does that mean? It means just slow down your breathing rate. If you are breathing at the rate of 20 per minute at rest, consciously you can immediately make it 10 per minute, 5 per minute. And whenever we get participants in our ashram here, we tell them in 15 days, I ask them a question. Tell me, now count your breathing rate. Don't change the breathing rate. I'll tell you in 1 minute. Somebody will say it is 25. Somebody will say 30. Somebody will say 15. Then next question, my dear friends, can you now consciously reduce the speed of your mind, the speed of your breathing, and tell me, I'll count 1 minute. Start now. Then somebody would say, I can reduce it to 5 per minute, 3 per minute. Then who can reduce it to 1 per minute? Only one hand would raise. Who would be that person who is already doing yoga? So this is Gati Vicheda. This is pranayama. That's why we always use exhalation time when they do Brahmari. Voluntarily how much you can reduce the speed, and involuntarily what is going on. The basic respiratory rate has to slow down. So this is, for that there may be many different types of pranayamas. We start with fast breathing types, high frequency breathing, and then go on to slow breathing. Then comes the mind. We have evolved several meditative techniques at the mind level, keeping this principle that the rate of flow of thoughts in the mind should reduce by doing any type of meditation. So because we see participants whose mind is very random, very restless, very fast, it is not easy for them to sit with eyes closed for a long duration. Mind goes away to its original speed. So we have used what we call as meditation using body movements, called cyclic meditation, which is a very, very powerful and doable technique for participants. Then we use sound meditation. mind-sound resonance. This becomes the basic program. In that, you ask me this question, how do you select specific practices for specific diseases? This is where our understanding of the physiology is good enough. We know that if a person's blood pressure is 150, 90 or 100, you should not be doing very dynamic asanas with vigorous bends. It will increase the blood pressure. Our aim is only to relax. Therefore, we give them, we delete all the vigorous dynamic asanas. We delete Surya Namaskara. We delete anything with acute bend and design those movements which does not involve any extra strain on the sympathetic nervous system. So that becomes the special technique for hypertension. And then we add the pranayama, meditation, etc. as before. So this is how we work on developing the modules.
So, understanding the physiology helped you decide which practices could help.
Pathology also.
Yes, and
What exactly has happened to the pathology?
Yes. So, what you're saying is understanding of physiology and pathology helped you decide which practices could be given to a certain patient and which practices.
So that we don't harm them.
Yes.
And that too, when we are going to introduce it in large number of participants and train large number of yoga therapists, we should be absolutely safe. We should select only safe practices because our goal is to give conscious wakeful rest to the sick organ. It's not to overstretch or increase their pain. That is only 20%. Another 80% is all breathing, mind management, diet, cleansing techniques, and lot of devotional yoga, knowledge yoga. All these gets incorporated, and that's good enough to help them to slow down the mind.
So, if there are different koshas involved in this,
Yeah.
so what you're saying is if the disease is pervading into different koshas, we need practices which are specific to those koshas. Like you mentioned, like in Annamaya kosha, they might need physical activity as well as changes in diet or dietary habits like the
Diet,
time,
kriyas, and asanas.
diet, kriyas, and asanas. In Pranamaya kosha, deep breathing, different pranayamas like Kapalbhati,
All of them
Bhastrika.
get towards slowing down the rate of breathing.
Yes. And in Manomaya kosha, different types of meditations or relaxation techniques.
And Vijnanamaya Kosha, the knowledge, what is the meaning of my life, what is my goal in life, why am I rushing on speaking, how can I come out of my intense passion that I drain out my energy. Passion is necessary for achievement in life, but if it becomes uncontrollable passion, it may become erratic also. So this is where we have to intellectually make them understand the purpose and meaning and goal of life to be happy and healthy. Everybody wants to be healthy and happy, but in the process of hoping that I'll become a multimillionaire, which would make me happy, we have to slowly make them understand. This is what we do in our yogic counseling.
So, ma'am, can you talk about your experience in beginning the research in yoga?
Yeah, this was the interesting thing that at the start itself, we wanted to, because Dr. Nagendra was a scientist and I was not in the publication field because of his experience in research in NASA, is that whatever we do, let us document and publish that. So what we did was, in our initial days, we were conducting large number of asthma camps, and we used to get very, very encouraging results, very fascinating learning for us also. And we started documenting, and there were people who were not practicing, large number of others who did not participate in our camps. So we called it as control study, and we started analyzing the data. And I also did not know where I can publish, in 1985, 84 time. Guruji knew more about writing papers. This was my first experience. We used to sit together and then we wrote up this paper on 52 patients control group, 52 asthmatic yoga group, where they were doing 2 hours yoga per day, morning 1 hour, evening 1 hour. And we were seeing fascinating results. And we had recorded their PFR, we had recorded their blood count. In fact, I remember in that camp, it was all our first experience. One of the pathologists came running on the last day, give me the mic, and he said, I want to announce how the eosinophil count has reduced in asthma patients within these 15 days. So everybody was excited. So we wrote up this paper, and then I took it to our Indian Medical Association Bangalore branch, who were also publishing some scientific papers, and showed it to them. No, we are not going. They rejected the paper. My professor asked me, and I came out, and it didn't affect us at all. Then my professor one day met me and said, "ಏನು ಮಾಡ್ತಾ ಇದೆಯಮ್ಮ?" He asked me, "What are you doing?" I said, this way you are trying to incorporate yoga and try to see how we can help asthma patients. I wrote up this paper. Show me, he said. I showed him where you are going to send. I sent it to Bangalore branch of IMA. They have rejected it. I don't know what to do. Why you want to send it to Bangalore branch of IMA? Send it to BMJ, he said. And BMJ people were curious, and our correspondence went on for almost 6 months, back and forth. Everything had to be on post. No online, nothing those days. And we had 40 pages of correspondence, which we had preserved for a long time. And finally that got accepted, 1985, control study paper. Then we compiled all other participants of asthma who were showing improvement. And I remember 670 was the sample size, no control group. This we sent it to Journal of Asthma. And Dr. Shirley was our scientist. She presented in one of the American universities. One of the audience at the camp, in the conference, raised their hand and said, "Madam, I think there is some error in your number of digits that you have mentioned in the sample size. It must be 67 or 70. It can't be 670 participants." So this is how we started learning and documenting. Then we do pilot studies, get the module, and then make it a randomized control trial. And over the years, this is one aspect of clinical research in asthma, hypertension. We collaborated with my professor of rheumatology. We published paper on rheumatoid arthritis. Then we collaborated with M.D. Anderson Center in Houston. We have a relationship with them for 20 years now. And there was one Cohen whose grandmother was a yoga teacher. So he was working in the integrative medicine of M.D. Anderson, which is the biggest cancer center in Houston. And we started publishing papers on the work of yoga in cancer. And our own PhD students, Dr. Arogyadhama Rao, who is now the director of CCRYN, his thesis was on cancer. Like this, we went on doing randomized control trial. This is the clinical part. But we also wanted to understand the deeper mechanism of action by working on normal healthy volunteers. So our Anveshana lab designed all those protocols, and Dr. Shirley was a pioneer with whom we were working, and we have several publications. Majority of all our paper was in normal healthy volunteers, the effect of that particular one single practice with a very tight design to show its effect on the brain waves, on the body, on their on their quality of life, etc. So this way, normal healthy volunteer study and sick people study went on, and we are now working towards mechanism studies, biomolecular bioscience.
So initially, as you said that even if the IMI in Bangalore rejected your paper about asthma, in which you had mentioned about the eosinophil count as well, as in you had mentioned all the parameters, yet they did not accept, but it was eventually accepted by BMJ, and it got a wider audience, and people were enthusiastic
Exactly.
about the research. And then you went on to do research in healthy individuals as well, and now you are looking more into the mechanism of action of yoga.
Now people like you have joined us to go deeper into the understanding in other diseases also.
Yes. There is increased research in India and around the world about the
After the International Day of Yoga, people have become little more open to accepting yoga-related papers.
right. And I came across a podcast by Dr. Andrew Huberman where he mentioned that the problem was the knowledge was either in books that people didn't read or were difficult to read, or it was stuck in research papers where again the normal people could not read.
Understand.
So again now, through people like you and Guruji and doctors around India who are working in holistic health, that data in scriptures and data in the research papers is coming into clinical practice, and more people are benefiting from that.
What we did in our earlier papers was we would only talk in the Western language. Don't elaborate too much on yoga. After 10 years of such publications, the reviewers would start asking questions more and more about how yoga works, what is the conceptual basis, what does the scripture say. So Dr. Shirley started explaining the scriptural aspect also in the discussion in these papers.
So initially, it was not a common practice to include where
Because they don't understand what is all this. We don't understand. The paper would get rejected. So we had to stick to the Western language itself.
like instead of nadi shuddhi, it would be alternate nostril
Not
breathing.
only the meaning, translation from Sanskrit words to English words, it was the basic concept itself. If we wrote about Panchakosha in a paper, they would reject it. If we wrote about stress is speed, they would reject it because we can't go on explaining in great detail 10 pages. So you write it into sentences, they say, what is this? We don't accept this.
But eventually, they got
No,
interested.
eh,
Right. So, ma'am, as a pioneer in the field, how do you see the field of yoga therapy and integrative medicine go in the future?
it has become a necessity, Satish. There is no choice. 10 years from now, 15 years from now, you young doctors will be so much wanted in the whole world that people are slowly understanding the need for integration. And yoga is the one which can be easily incorporated without causing any questions because there is no drug interaction. You are not giving any internal medication. So external therapies of naturopathy, external therapies of Ayurveda combined with yoga as a complement to modern medicine is the theme now. And there is no choice, we have to work on this because in spite of this almost 50 to 60 years of research on NCDs, all NCDs are on the increase. Diabetes has become a pandemic, hypertension even more. Every third person has hypertension, in spite of all the knowledge, because we are only cutting the branches of the tree without going to the root cause, which is the mind. So people have to work on this and see that integration becomes a day-to-day practice. Every participant who comes to a hospital should first see the naturopathy or yoga person to change their lifestyle. Talk about diet, talk about physical activity, talk about their habits, change their mindset, and through that it should be every hospital should have a yoga expert, a naturopathy expert, diet, nutrition advisors should know about mind and the effect of what effect on the mind of the food that we consume. So every speciality will have to incorporate yoga, and it is, we have no choice, it has to happen, it's going to happen, and it is happening. Thanks to the present day vision by our Prime Minister, slowly things are getting incorporated even in medical school, and every medical school should include yoga in their curriculum.
So, like even in IMHANS and AIMS, they have started departments of integrative medicine, or even in private medical colleges like Kashibai Navle or Kolar Medical College, they also have started department of yoga and
Again,
integrative.
Satish, what Vivekananda said 100 years ago. He sat in meditation on the rock in Kanyakumari. What was the revelation he had? Go to America and talk from their platform, then our Indians will accept. This is what will happen for all of us in complementary medicine, or add on yoga therapy, or add on integration of the traditional systems. Chinese medicine, how did it got incorporated? Because America did it and how it got accepted. So whatever we speak from the real, sincere, scientific, strictly controlled setup is the one which is going to happen. So that is the integration of the doctors themselves, Western doctors and Eastern doctors, shall happen.
So, there is no choice for anybody, and eventually, people, what you're saying is they need to work together.
I'm sure you will all be doing one single course. M.B.B.S different, B.M.S different, B.M.S different, no. So in fact, we have even 5 years ago, or even earlier, we have already prepared the M.B.B.S syllabus, integrative medicine syllabus, where we have taken the syllabus from all the courses, removed the common ones, and deleted some extra ones for the basic degree. And that is the way things shall move in future.
So this has already started. So it's the syllabuses are being designed, the subjects are being designed, and eventually students from all backgrounds will come under one. Like they will have some common subjects, and if they want to specialize, they would.
In MD, they will specialize.
They would specialize in MD. Right. So they would have subjects like Ayurveda, yoga, naturopathy, everything in the bachelor's degree.
Exactly.
And if they want to specialize in any one of them, they could choose to do so after the graduation. So thank you, ma'am. It has been a pleasure talking to you, and I'm really sure this conversation would be enlightening for the audience, both medical and non-medical, and we would like to have a conversation with you again on some other related topics. So, thank you, ma'am.
Thank you. Thank you.